I just want to fix my ADHD. You know, what would your response to that be?
So I would first say, let's see if you have ADHD. Parents are not able to distinguish attention and memory.
So are we saying it's okay if you do it last minute because that's what works for you? Hello and welcome everyone to the second episode of Attention Deficit Hyper Desi. I'm Coach Ankita, Jagtiani, Dadachanji, and I'm an ADHD coach, a fellow ADHDer, and also a posh consultant. I'm based out of Mumbai, and the purpose of this entire podcast is just to bring ADHD information to you all from various experts in a very simple way and in a way that is completely stigma-free. So today we have Siddika Panjwani, who has been a very big part of my ADHD journey as well, because she's the one who diagnosed me. And everyone who comes to me will ask me, what's the diagnosis process? So we have Siddika here, who's a clinical psychologist who works with children and adults on psychological assessments, especially ADHD. Siddika has been practicing for over 25 years and is attached to hospitals like Lilavati and Globus. So thank you so much, Siddika, for joining me here today.
My pleasure.
Would you like to share a little about your journey, how you got into the diagnosing piece?
So essentially I started working as a neuropsychologist at KEM, and then that is where my career went ahead further. I for some reason was fascinated with figuring out why a certain things happen. So like suppose if somebody comes to me with a particular concern about their behavior or their brain function, why is that concern happening? So and that fascination somewhere grew into my work profile. So I never actually got into the counseling or the regular bit of work really as a psychologist, and stuck my game to more or less assessments. And that is what at some point of time brought me to adult neurodivergence.
Today, almost 5 to 20, I mean the range is large, right? 5% to 25% of people in India have ADHD but are undiagnosed. So how have you seen the change in Indian households or just generally in India in the past 10 years?
So see, till a point of time, till we did not have the IB boards or the IGCSE boards, so till we had the typical SSE board, till the child was not creating behavior concerns in class, till the child was academically functioning adequately, nothing was diagnosed. So then I have people coming in their 30s and 40s saying that, we completed college because till there was a structure we could cope adequately. At work, till we were a team member, we could cope adequately because there was somebody telling us what to do or, managing our work. The moment we've reached a team leader role or a managerial role, we are struggling because then self-motivation becomes a factor. Or when they start working as a freelancer.
So when there's no structure, then the challenge occurs, or if there is
too much more structure. Evident. Or if there is too much structure. Both don't work with ADHD.
So the extreme, so how do we bring a balance? But that's always
the question. But now the schools are very aware, because one is they expect the children to be much more participative in class. They expect the children to be, to go beyond the exam learning, so as to say, which is where these concerns become more evident. So that is one side of the story. The other side of the story is the amount of exposure. Like I was just telling somebody the other day that till I was in school, the media exposure was 2 hours of Doordarshan. Which included even something like Amchi Mati, Amchi Mansa, which I used to watch because there was nothing else to watch. And now there's a child who has the entire world on their fingertips. So whether it's the smartphone, it's the gaming, it's the tablets, it's the TV screen. So the distractors have increased exponentially, which is where those attention challenges are much more evident.
In earlier times, you would see that in many households, there used to be one working member, one working parent, and one parent looking after the kid. Now, of course, things have changed, evolved. In many homes, there are 2 working parents. Do you feel that has also broken the structure a little bit or come in the way in any way?
That's a possibility. The other big factor is grandparents. Okay. So till a point of time, there were actually multiple parental heads at home. So the grandparents were there. So like I remember for a good part of my school, my grandmother would come drop me up, pick me up. She was a factor where I learned Gujarati, which was my native language, which I would have never learned otherwise. So a lot of role she played in what I did, or taking me to the park in the evening. So even if my mother was busy with other things, my grandmother was always there to manage these issues. Now with the nuclear family structure, that grandparent role is not there.
And do you feel with adults also now coming into nuclear families there are more challenges that they face with structure and routine on a daily basis, and,
Yeah,
how would
absolutely.
you see that?
So see, when you were in a joint family, there was a system that people in the house woke up at a certain time. People had breakfast at a certain time. They did their religious rituals at a certain time. They had a 9 to 5 job routine. So life went by a structure. Now today, if I look at my work, I can start work whenever I want because it's a consultancy. So and morning there is nobody in the house to tell me I have to wake up in time. And because there's nobody to tell me wake up in time, there's nobody to tell me sleep in time. So that entire circadian rhythm gets disturbed. Eating patterns have got disturbed. A big factor is A, the availability of food options, B, the availability of finances for those food options, and 3 is Swiggy Zomato. So even at 3 a.m. in the night, if I feel like I want to eat something which is junk, it's available to me in 10 minutes.
And food, environment, lifestyle routine is a big part of managing ADHD, right?
It's a very big part of managing ADHD. See, people think that ADHD can be managed by a magic pill. Yes, these medicines work beautifully, I don't deny that. But they alone cannot handle this. So till you do not get that kind of a routine, you regularize your eating, you regularize your sleeping, you regularize your work hours, that med alone is not going to increase productivity.
Generally, Siddika, if we see ADHD, is it always loud, especially with adults? What are the general symptoms that they come with?
So the thing is that these days the people have read up already a lot on social media or heard some kind of videos or some people with ADHD who've spoken on them. So they come actually to me with a bunch of diagnostic labels rather than anything else.
Okay.
So they will come and say, I have executive dysfunction, I have time blindness, I have multitasking challenges, I am disorganized in my space. So a lot of times I need to tell them, okay, I understood your labels, what happens to you?
Sure.
You tell me in your day-to-day life, how are you struggling? Because that is a very important input for me, because that it tells me whether this is coming from an ADHD, this is coming from an anxiety, or is this coming from some other area. See, all attention challenges are not ADHD.
Okay, so how would we distinguish the two, attention and ADHD challenges?
So see, if you ask a generic population, anybody who says I have 100% attention is very difficult. Unless you are a monk or you are some kind of a spiritually enlightened being, enlightened being who is able to kind of have that kind of control over their cognition. But otherwise, most of us struggle with attention in day-to-day life. Whether this attention deficit A is dysfunctional or not, is it hampering your day-to-day functioning? And are there any other variables which are impacting attention beyond a neurological ADHD? Okay. So one of the major factors we see these days, as we already spoke about, the sleep deprivation. 2, anxiety. 3, stress levels. 4, a lot of times you just have too much on your plate to focus on a thing at a time. 5, you're not interested in your work. So interest in a lot of ways governs attention, whether ADHD or no ADHD.
And our phones are not so helpful, devices
Absolutely,
are not
because
so
there are
helpful.
constant notifications popping up. Right. Like you have a smartwatch on your hand, all the time there's a vibration. You are very, very keen to go back and look at it. If you don't look at it, it's somewhere in the background of your mind, okay, something has happened, what happened? So, you're constantly, there's a fear of missing out, or there's a fear that something will happen and I am unaware of it.
How would somebody sitting at home be able to distinguish these things?
So first and foremost, I ask them, when did these start? So a lot of times parents, especially of adolescents, will say the child was attending adequately till the pandemic. In the pandemic, we gave the child a phone or tablet because that's the way the child could study, because it was a virtual class. And post that, the screen use has gone up and the attention has plummeted. So there is a clear concordance there. 2, usually my assessments is where the role comes in then, that if there is an attention challenge or there is an ADHD. So with the assessment, I first look at a personality evaluation.
Okay.
That is a mandatory first step. So a lot of times people who come to me for ADHD are actually extremely upset that why am I doing a psychological evaluation when they have a neurological problem.
Okay.
And I tell them it's the same brain. And ADHD and mood disorder are very coexisting conditions. Okay. So a lot of people with ADHD will have emotional dysregulation. A lot of people with anxiety, depression, any kind of mood disorder will have attention challenges. So if I have to tease apart the two, I need to evaluate both.
So you will first evaluate the personality And then you go on to evaluating the executive functions.
So then I evaluate ADHD, which is at 2 levels.
Okay.
One is a self-rated scale, which I tell people that this will be positive, because by the time you've come to me, you're primed on the condition.
Okay. What exactly does a self-rated scale mean?
So these are bunch of 10, 15, 20 statements that tell you, do you have this? So are you able to focus attention for a sustained period of time? Or are you able to do your day-to-day tasks in the mentioned time frame? Or are you able to follow schedules? Or do you procrastinate? Do you work very close to deadlines? So do you work better under external pressure? Now all of these are true for people with ADHD, but all of these are true for anybody for that matter. Because these scales do not have a gradation.
Okay.
So usually I equate ADHD with, let's say, put it at COVID. People who had COVID some of them needed paracetamol, some of them needed a ventilator. But the test that you did, the blood test said it was COVID. So is a paracetamol COVID person needing a ventilator? And should that person be given that treatment? So like COVID was a spectrum, ADHD is a spectrum disorder. So you have a borderline ADHD, you have a mild ADHD, you have a severe ADHD. The self-rated scale does not make an adequate distinction here.
And like you said, you come in with so much bias anyway. Right?
Absolutely. See, if I'm convinced I have a certain disorder and I do a self-rated scale of that disorder, it will come positive.
I'm sure many people have come and said, I just want to fix my ADHD. You know, what would your response to that be?
So I would first say, let's see if you have ADHD. That's the first step. So 1, as we said, we do the MCMI. 2, we do the self-rated scale. 3, we do actual tests of attention, speed of processing, executive functions to see how much ADHD do I see on my test.
Okay.
Because a lot of times there might be a discrepancy between how much ADHD you are perceiving and how much you actually have on assessment. And that gap is usually filled up by either there is a mood disorder, anxiety, some variable of personality, or it is just your lifestyle or too much to do at a time.
So if the self-rated scale is positive, like you said, in most cases it will be positive, and the ADHD executive functioning test that you do is negative, what happens? How do you?
Oh, I have had people who have been very, very upset about it. So they feel that social media or AI is probably more equipped at diagnosing ADHD than a clinician who's seen them in person. Because a lot of times it's a very biased thing that if I hear what I want to hear, then I would obviously lean towards that opinion as compared to an opinion which is contrary to what I am thinking. Secondly, a lot of times for ADHD, one is somebody has told you, a friend has told you, a colleague has told you, and they have said, I took this pill and my focus is bang on. So then you're either in search of that magic pill or then you're in search of finding a reason to pin your concerns on, which is outside you. So if it's a neurological problem, then I am not responsible for it. But people don't understand that I'm not responsible for my psychological concerns either. They are as treatable or probably better treatable. I usually tell people, if you have anxiety, I'm very happy because it's a treatable problem. ADHD you're going to live with for your life.
Yeah, you have to constantly work on it to manage it.
So it's like, a weight gain or diabetes. It doesn't go anywhere.
So we are saying that in India, generally, people are happier to have a ADHD positive diagnosis than not.
Absolutely.
From at least the people
you see, yes, which might be a very biased population.
Sure, of course.
Because anyway, if they think they have ADHD and they need help, that is the population I see.
Absolutely. So have you ever had a client who's come to you, a patient who's come to you with their parents, and their parents just say, sabko hota hai, my kid is just lazy? Are these some common labels that you hear?
No, absolutely. All parents think that, if you work hard, ADHD disappears. I have had parents who want their child to do yoga, meditation, all kinds of things. And which may not be wrong options, but only thing is, imagine you're coming to me saying that the brain is not stable, the brain can't focus. Meditation is absolutely contradictory to that because you need to focus. So a lot of times I tell them, if you want to use things beyond medicines, do things like taekwondo, kickboxing, some kind of sport where that cognitive energy is more channelized in a disciplined manner than meditation where the child is going to sit and think of 1,000 things.
Because that will lead to more rumination and your brain shutting down, I guess, with
Absolutely.
the overwhelm. And anxiety, like you said, is generally a common comorbidity. So Siddika, you were sharing that when somebody has hyperactivity, they generally need to redirect it through say doing taekwondo, playing a sport, basically getting it out. What does somebody with the inattentive type do or practice, in their daily life?
So inattentive type, usually when they come to us, we have what we call a cognitive rehab regime. So here, this composes of two parts. One is compensatory strategies.
Okay.
The other part is attention exercises.
Okay.
So compensatory strategies are about working with your schedules, adding structures, getting timetables, reducing the distractors, reducing the notifications, the rest of the stuff that we spoke about. The attention exercises are actual exercises that we give people, which they can practice for few minutes on a day-to-day basis, which actually helps their attention in certain ways. These can be done in a more structured manner by an occupational therapist, but some people, for occupational therapy, if you have to go once or twice a week, it is not feasible or possible because that can't be done online. So then we do online exercises once a week or once in 2 weeks as neuropsychologists, where we give them a bunch of tasks that they complete, and we keep increasing the complexity of the task basis on how much are you doing regularly, how much is it helping you.
Now that you spoke about online, I'm going to go back a little. Can the diagnosis, the ADHD, the personality diagnosis also be done online?
So the personality evaluation, the self-rated scale can definitely be done online. I had tried doing the formal cognitive assessment also online during the pandemic, but somehow the flavor of the individual doing the test with me is as important as the person doing the test.
Sure.
So which is why I prefer doing it in person, because a lot of times people who are high functioning may not do badly on the test per se, but when I do the test with them, I see that they are putting in a lot of effort. They are trying to shut their eyes to concentrate. They are probably taking a little longer on a task. They are trying to fidget so that they can keep their attention in place. So those are very important variables for my diagnosis, barring just the scores that I get on the test.
So online is possible, but it's not the best way to go. And yes, because it is very taxing to do those, to do the test. And how long does it generally take to do all these
So
assessments?
the entire assessment with the personality, self-rated scale and my assessment could take anywhere between 90 minutes to 2 hours 30 minutes, depending on the person's speed of doing it, and also how frequently do they need a break, how much can they continue at a stretch. Sometimes I may even break it over 2 sessions. In certain people who've had academic challenges, I may include an IQ test as a part of the ADHD. So in certain people who are very high functioning academically, I wouldn't do the IQ test. Then I just do attention executive tasks, so which are tasks of planning, problem solving, decision making, sustained attention or concentration, complex attention, where you have to do multiple things at a time. So that entire gamut of tests, speed of processing, so how much can you mentally process information at a point. But if somebody says, no, I struggled academically because of ADHD, then I want to see what is the core potential of the brain. And is it just a concern with attention, or the overall potential has limitations in certain areas?
Cultural narratives that generally you hear in Indian households with your Indian clients.
So one of the things is, a lot of times parents are not able to distinguish attention and memory.
Okay.
So they will say he heard a song 5 years back and he still remembers the song. So how is it ADHD? Or the child can play Lego for 2 hours. So how is it ADHD? Or he's on the screen for 4 or 5 hours and even if I call him doesn't listen. So how is this ADHD? He was that focused. So ADHD is not a lack of focus. It is a dysregulation of the focusing mechanism.
So the attention is there, what I understand.
Yes, but you can zone in, zone out based on your interest levels.
So that's why they call it an interest-based nervous system, or interest-based.
Absolutely. And if a screen is definitely not a parameter of attention, because it is something that grabs attention. See, what is ADHD? That where I need to consciously put in the attention is where the challenge is. It is not when the attention is pulled in. So the example I give parents is, if you're watching a James Bond movie or any movie, where 3 hours go you don't even realize. Or when your popcorn ends you don't even realize. But if you're made to listen to a lecture, in half an hour you feel something is itching, the chair is not too comfortable, probably you need to use the washroom, probably you need to have water. So that is because your brain cannot continuously put in the effort to focus on that activity there.
So there's boredom also that perhaps kicks in, and when boredom kicks in, well, an ADHD brain immediately shuts down.
Absolutely.
And they'll find every other way to procrastinate.
Absolutely. So I tell the parents, what is the cardinal thing? How much time is your child able to sit in a place alone and study without somebody sitting with him or her?
And what would be a similar thing for adults, like with parents?
When you're working, how much do you drift off? How much do you procrastinate doing tasks? How much are you able to get a self-motivation to complete a task in a certain point of time? A very important marker is if I have 7 days to complete a task, an average person will start on day 6. That is not ADHD. But if I'm starting 2 hours before submission and struggling to cope, that is very likely ADHD. Or it could also be anxiety that you're anxious about doing the task and so you procrastinate and then it becomes overwhelming. But if you have ADHD, you will perform better under external pressure. But when you have anxiety, it will become worse under external pressure.
So are we saying it's okay if you do it last minute because that's what works for you?
Absolutely. See, how many of us have studied through the year for an exam? I haven't. I've always studied the night before.
Right.
But am I able to deliver at the end? Yes, I'm able to deliver. Then is this something which is dysfunctional?
Many people will say that, oh, I do everything last minute and that hampers my relationship, especially if they are parents. An adult who's a parent will challenges with picking up the kid or getting the backpack, etc. I see that a lot. So it's okay. It's just how the person is, that's their personality.
That's their personality.
That's really powerful.
I mean, if I talk to 10 people who do not have any diagnosis of or any kind of neurological condition, how many of them consistently work daily to finish something that has to be done a month later? I mean, if somebody does, it's more surprising than not.
Right. What are some of the red flags or quick fixes that should be avoided during doing during a diagnosis or while somebody is looking to get a diagnosis?
One is, please do not get a diagnosis from social media. Do not get it from ChatGPT, Perplexity, because a lot of times, these diagnoses are very generic. Like if I tried doing a few of these scales just to get an understanding of what comes to me, most of these scales diagnosed me with ADHD.
Okay, so they are made to diagnose the individual.
No, they are made to diagnose attention challenges, which I know I have as an individual. But does it hamper my work? Does it hamper my day-to-day functioning?
Sure. You see more and more of that today?
Absolutely. Absolutely. See, as we spoke of children being hooked to the screen during the pandemic, I think that is true for all of us. The amount of time we spend in a virtual world is much higher than what we spend in the real world. At least like the me time. How many of us really would spend an hour reading a book? See, I actually, if I say myself, I was positive on those scales. I actually got myself a Kindle, even if I have an iPad. Because on the iPad, I would switch between the book to some other app because something will pop up. And I can't focus on the book.
So it's important to find ways to put away your distractions.
Put away your distractions.
So actually, before you came and we were setting up, we were talking exactly about that, right? That when was the last time any of us have just sat and read a full book? Now it's also easier with getting a summary, understanding what the book is, just uploading it. In fact, there's so many platforms also where you can put up your book or your research paper and get a 20-minute lovely podcast.
Absolutely.
Right? And then you hear it, it's so interesting. So, but these are also tools that can be used by somebody who is tested for ADHD.
Absolutely. See, the tools are not bad. The whole idea is the excessive reliance on the tool, which is where the concern is.
So, Siddika, you explained the whole diagnosis process so beautifully. Can you tell us what happens after the diagnosis?
So then I meet people for a report discussion.
Okay.
Where I explain to them, I show them the graph of the MCMI, the personality inventory that we spoke about. That, this is what your current psychological status is. Yes, you do have anxiety, you do have depression, or you don't have any of those concerns. This is what your personality looks like. Then put in the self-rated scale. Okay, you think you have this much of ADHD, and this is my test which says you have this much of ADHD. So I usually tell people, put it in perspective of a number line. So I said, if I put your ADHD problem on 0 to 10, 0 being no ADHD, 10 being a lot of ADHD. You're perceiving your problem, say hypothetically a 7 or 8 on 10. I am finding on my test it's a 3 or 4 on 10. So this discrepancy is where your anxiety is playing a role, or your work styles are playing a role, or your household environment is playing a role, or your distractors are playing a role. So there's always a discrepancy between perception and the actual concerns.
So it's interesting. Recently, I was talking to somebody and they said, we did really well in university and shared some of their strengths. It came out that this person is a very creative person. Now suddenly they took up a job which seemed great because the brand was great, but the role that they got was a very data focused role. And they said, oh, my attention, my interest, I was not doing well, I was not able to deliver my potential. And so could it be ADHD, right? Now, immediately, so this is what you're trying to say, right? That when you don't play to your strengths, you end up actually feeling that you could have
Absolutely,
ADHD.
absolutely. And people with high intellectual potential inherently have some degree of ADHD because there's a lot of cognitive energy which is there. And if it is not utilized, it is going to create concerns.
Right. So, a lot of IITians, Ivy League students, high achievers, so to say, would be coming to you. What are some of the symptoms they come to you with?
One of the primary things is the lack of consistent focus.
Okay.
So they are saying that we know we are capable of this, we have performed at these levels, but our day-to-day performance does not match those levels. So my potential is say 100, I am functioning at 80, I am functioning at 70. So is this ADHD?
And is it more often than not, or?
I think it is not that often because if I am a gold medalist from a premium university or from a well-reputed institution, the chances that I have a moderate to severe ADHD which needs treatment is extremely limited.
So a lot of them are mild cases which have been masked over the years because their IQ perhaps was.
The compensatory mechanism. And the moment you come to day-to-day life where again going back to the lack of structure, then that ADHD starts surfacing.
Once the diagnosis is done, once the report is done, what is it that you then share as strategies for someone or next steps for somebody who's
One
been
is
diagnosed?
changes in day-to-day life that could help attention. Two is the compensatory strategies that we spoke about. And three are the brain exercises. A lot of times people say that brain exercises are very boring, it's very structured. Then I tell them go back to playing games. Table games, not with your device, but with somebody.
Interesting.
Because that's a lot of attention that you need.
So like a table tennis would be.
Table tennis would be good, a Scrabble would be good, a chess would be good, a Ludo would be good enough. Because you're focusing on that task which is not grabbing your attention. And you have to remember what somebody did, what I did. So if 4 people are playing, there's a lot of multitasking that your brain is doing. Don't make timetables which are very enthusiastic.
Sure.
Have smaller goals. Easily achievable goals, because the moment you tell somebody you have to make a timetable, the timetable is so supremely efficient and meticulous that it's non-executable. So those are the strategies that people need to learn. So I don't give them anything that they don't know. I just probably modify it to something that would work better.
And I'm guessing for some you may suggest medication if required.
That is definitely an option. So medication. So the 4 things I usually add is one is medications. So where the neurologist or psychiatrist who's treating the person will take care of it. Second thing is whether some kind of talk therapy or counseling is required, if there's a personality component or if there's more of an emotional component. The third is definitely the cognitive exercises or the day-to-day strategies. And the fourth is the occupational therapy bit, where if people have the time, energy and bandwidth, then they can go and regularly do these exercises in person, which will help attention. So we're looking at the hardware, we're looking at the software.
Lovely. So it's a holistic plan once they come to you.
So see, what is attention deficit disorder? It is the RAM of my computer is limited. A lot of times it is not just the RAM, it is we open a lot of ultra HD windows in the background, which is the anxiety, depression, distractors, too much in life, disturbed routine, work-life balance, and those ultra HD windows actually suck onto the RAM. So I tell people it's easier to close the ultra HD windows and let's see how much of the RAM is still a problem.
That's a beautiful way, and I'm sure everyone listening will remember that analogy. So Siddika, just before we close, I have a couple of questions or statements for you. So it's like a rapid fire round. First word that comes to your mind when you hear ADHD.
Focus.
Okay. One ADHD myth that you wish would disappear from Indian households.
It is laziness.
Funniest thing that someone has mistaken for ADHD.
My spouse thinks that I don't listen to them.
Interesting.
I don't think any spouse listens.
Diagnosis in one metaphor.
I think we already spoke of COVID. That's how I tell people that it's a spectrum disorder. Look at it as a spectrum. Everybody with ADHD does not need every treatment option available.
Lovely. So one thing you wish families understood better about ADHD.
Look at it as a condition that needs treatment and not as a condition which can be just behaviorally managed.
Thank you so much, Siddika. There are a couple of things that I'm definitely taking back. One of them being it's very important to have clarity rather than self-diagnosing. So get a diagnosis, get a holistic diagnosis, not just ADHD self-rated scale diagnosis. I think it's beautiful how you the COVID analogy you shared. I think it's beautiful the way you shared it, that it's a spectrum. Someone's needs may be A and someone's B, so be aware of what your needs are. And I think earlier when we were chatting about parents generally saying eat almonds and eat cashews and that will help your brain or that will improve your attention, is not always true.
It's definitely not true.
So reach out to an expert who can actually help you. So thank you very, very, very much for being here and for your time. If you've ever felt misunderstood and unsure about your ADHD, I hope this conversation has given you some comfort and clarity both. If you've enjoyed this episode, share it with somebody who actually can benefit from learning or knowing about the diagnosis of ADHD. And follow us on Attention Deficit Hyper Desi. We're here to bring you more and more and more content on ADHD in an absolutely simple manner. So here we are reminding you that ADHD is not a flaw, it's just a rhythm, and we are here to dance to it together. So thank you for watching and see you in the next episode.